So let's talk about what's coming soon. You know, we're going to be looking at probably a second PARP inhibitor that's going to be approved, we hope, fairly soon. And that was based on the Embraca data, which just came out, in San Antonio, it just came out. Could you tell us about that?
Sure. So Embraca used talazoparib, a different PARP inhibitor, but otherwise was a very, very similar randomized phase 3 trial, really the same population that Tiffany just talked about in Olympiad. These are patients with metastatic breast cancer, HER2 negative, germline BRCA mutation, no more than 2 chemotherapy in the metastatic setting. And again, they were randomized to either single-agent monotherapy PARP inhibitor, this time talazoparib, or to, again, standard chemotherapy, not platinum. So really almost identical design. And the efficacy, the results were very, very similar. Again, there was a significant improvement in progression-free survival. Median PFS was improved by about 3 months. Again, the hazard ratio, 0.54. So really so similar. Still like Olympiad, no improvement in overall survival, although I think there's hope that the curves will separate. The hazard ratio was 0.76, which was tantalizing, so we'll see. But very, very similar efficacy. Again, better quality of life than the standard chemotherapy, so very similar. Toxicity was different. I don't know if you want to hold off on talking about that, but a little bit different. A little bit of alopecia, 25% had alopecia. That may be significant, and a bit more myelosuppression. So I think the toxicity was a little bit different. The efficacy really looked similar. There are other PARP inhibitors, but the Embraca is really the most far along in terms of the phase 3 that we heard about in San Antonio. So I think that that's the next one. There are other PARP inhibitors being evaluated in the early setting, which I think we may talk about later, olaparib in the adjuvant setting and some other ones moving all the way up into the neoadjuvant setting. But I think that's the other well-established, and I would be, looking for FDA approval in that one.